vitals is a really important topic which can come handy at times of emergency to save someone's life. When to give CPR? If the person is not breathing, if the person is gasping for air, or if the person is unconscious. Now coming to the steps of CPR. You can lay the person flat on their back and then you can tap on their shoulders and call out for their name in case you know their name, or else you can ask them, are you alright? And make sure you're loud enough so that the person can hear. Call for help and also call for an ambulance. If the patient is not breathing, immediately start your CPR. CPR consists of mainly two components, that is your compressions and the breath. Now compressions, in order to give it properly, you have to kneel down next to the patient in either of the side and make sure the airway is open. How can we make sure of that? That is by tilting the head backwards and lifting the chin. This is a position where we can make sure the airway is open. Also, you can check if the tongue is not rolled back, because that will make it difficult for the patient to breathe. Place 2 fingers in the center of the chest between the nipples. And after placing these 2 fingers, just above that, place your other hand, heel of the other hand, right above the fingers. This is how you can make sure you're going to give compressions in the proper position. Place the heel of the hand over the other hand. You have to interlace your fingers. And while giving CPR, you have to keep your elbows straight and your shoulders are directly over the sternum. After which you have to press down at least 2 inches. Each compression, actually you have to press down at least 2 inches and make sure the chest is coming back to its normal position. That is, after going down 2 inches, it has to come back to its normal position. Now you have to know how many compressions to give. You have to give 100 to 120 compressions per minute. You have to give CPR fast enough that it is at a rate of 100 to 120 per minute. Next important part is the breathing. Look, listen and feel for breathing. This should be done before starting the CPR, and then you have to make sure the airway is open, which we did earlier. After that, pinch the nose of the person and give 2 rescue breaths. Pinching the nose is important to make sure that the air you're blowing in is going into the lungs, and you have to watch if the chest is rising. From here you have to watch, okay? You have to give 2 breaths. You have to give 30 compressions for that 2 breaths, and this cycle must go on. 30 compression and 2 breaths, okay? In case you call for an emergency and they have a defibrillator, then next you can hand over the patient to them. If there is any kind of life signs present, that is any kind of response from the person, then definitely stop the CPR. Also, if the patient is not at all responding even after 20 minutes, then again you can stop giving CPR. Now, how to remember what to do in CPR CAB. CPR CAB. C for compressions, A for airway, B for breathing. Thank you for watching. Make sure to like, subscribe, share and comment in our channel.